Well, June is Cataract Awareness Month. So many Americans struggle with this. A lot of people in my family also. And if you're one of them, Eyecare is ready to help patients right now achieve their goals with their cutting-edge technology and, of course, their experience.
Yes. So I actually went there. I visited their location down in Lone Tree, and that's where they do all their surgeries. Really great staff. I talked with the Dr. David, I think, Litoff. The guy was incredible. We had a nice conversation. And take a look at what they can do for you, especially for cataracts. All right, I'm here with Dr. David Litoff at this is the Eyecare in Lone Tree. Is that correct?
That is correct.
And you do all of your surgeries here.
Correct.
Yeah, and one of the things you do here is address cataracts. And June is actually Cataract Awareness Month, right?
That is correct.
So tell me about that.
Well, cataracts are very common. It's something that almost everyone will develop at some point as they get older, and it's something that reduces your vision with time. And with the technology that we have now, we can significantly improve people's vision and correct their cataracts. And it's something that I spend a fair amount of time doing.
That's what I hear. I hear you're an expert at this. So who's at risk for cataracts?
Yeah, so I would say cataracts fall under different categories. I would say there's a whole class of cataracts called congenital cataracts, where babies are actually born with cataracts. It's a very small population, but it does happen. So that's one area. I would say what I deal with is really older people as they develop cataracts. And when I say older, it's really starting to be seen even in what I would say younger older people. So as you get into your 40s and 50s and 60s, we often see cataract formation. And people come in with some decreased vision that's interfering with their lifestyle due to cataracts at that age. And that's when we start discussing the options of cataract surgery and how to improve their vision.
You and I were just chatting earlier about this, and I was saying, the light goes in through your eyes, that's necessary, and you were saying, yes, but also as you age, the cataract tends to block that, and I thought that was really fascinating. So nobody escapes this, right? I mean,
Yeah, everyone develops cataracts to some degree. It is sort of amazing that some people develop them much faster or much sooner than others. So I see some people, in their 40s that develop pretty significant cataracts and kind of trying to determine a reason, and can't always tell. It's just they've developed cataracts early. There's certainly some genetic factors that may play a role, but people can develop them at a relatively early age. And there are other people that are even into their 70s and 80s that even sometimes early 90s I've seen where they don't have too much cataract formation. I mean, they have some, and it's reducing their vision, but it may be something that they can live with and they're doing okay. So really, the time, I always tell people, the time to deal with cataracts is when it starts interfering with your lifestyle, and that can vary.
So it's important, and you guys can catch this if you come in for a checkup. You'll catch this, right?
Right. So we can diagnose the cataract. We have different instruments, our microscopes. We can look in the eye, and we can actually visualize the cataract, and we can get an idea on how much it's affecting the vision. And just talking to the person can also tell you how much it's affecting the vision. I mean, some of the first symptoms often are glare with nighttime driving, and you often have people coming in saying, it's really difficult for me to drive at night. And we look in and we see cataracts, and we say, yeah, that's probably what's contributing to this. We can make this better.
So what can be done about this? I mean, you guys do everything here, but is this a simple thing?
I would say it's certainly improved significantly from years ago. So with cataract surgery, what we're doing is we're removing the cloudy lens, or the natural lens that's gotten cloudy, and replacing that with a clear plastic lens. And that's essentially what cataract surgery is. And I would say there's been some big breakthroughs and really improvements in both the techniques of removing the cataract and also the types of lenses that we use, that we implant with the cataract surgery. Those are, I would say during my 30-year career, we've seen some dramatic improvements of both the cataract surgery itself and the results.
In your experience, is it mostly now routine?
I would say that it's becoming more and more routine. We take every cataract surgery seriously. Everyone is, we individualize the surgery. We want to make sure that every person has a good experience. So I would never say it's totally routine, but it's something where we do a lot of, and it's something where we get really good results.
All right, well, thanks, Doctor. I appreciate it. Again, June, Cataract Awareness Month. Go for the checkup, and if you need it, these guys can help you out here. Icon Eye Care offers comprehensive eye care, LASIK, vision correction, and cataract procedures at several different locations. To learn more, give them a call at 720-893-8960 or visit them online at iconeyecare.com. Thanks again to Icon Eye Care for sponsoring this segment.